Good morning, it's Jennifer Shepard, your integrative manual physical therapist. I always do consult calls with my prospective patients for a couple reasons. I want to know what they're bringing to my table, kind of what's their history as we look at multiple systems. I start to do a brief screen as far as what systems are involved, because that just gives me an idea as far as how complex are the issues and cellular health and structural health that this person is bringing me. And then it's super important for me to start to unpack it a little bit so that they have an idea of here's how your body works, right? Here's the brilliance of your body. Here's how your body has adapted to things over time. You've got symptoms. Here's why others have struggled to help you with your symptoms, because very few people look at systems, multiple systems, how all of the systems work together for better or for worse, and then how those systems are integrated in the whole of you. So as I share with my patients, it's my job to unpack the story, look at their body from a whole person point of view, multi-system point of view. So for example, I just had a call this morning and a patient is interested. Patient is still struggling with some nerve pain down the arm, some back pain. She's managed it very well. She found a great therapist who was able to do some structural work. In the past, she had done tons of physical therapy, doctors, it's tennis elbow, just writing it off for here's where your pain is, therefore that's where your problem is. And that's rarely the case. Where your pain is very rarely the only problem or the only thing that needs to be addressed. So fortunately, she found a therapist who was able to support her. She no longer is able to work with that therapist. So, but she is still struggling with some arm pain and some back pain. So we start the conversation with the structural conversation on how trauma and compensation leads to strain on tissues, on nerve tissue. We talk about the dural system. We talk about the structural system, how it falls from the pelvis, C-sections. Here's many potential reasons that affect the structure, that create compensations, that create strain on the system, because it really continues to come down to where is there strain on the system. The system is burdened. The structural system is burdened. It's trying to compensate. You're still moving through space, and therefore areas are getting beat up a little bit more that weren't designed to take all this extra force. So as we continue to unpack the story, just briefly, I have my patients fill out, it's the medical system questionnaire, because in my practice, as I've evolved into visceral, vascular, and neural manipulation, and then come into functional medicine, in which I've done certification through the Institute for Functional Medicine, the concept of cellular health, we can no longer ignore as manual therapists dealing with pain and structure, because the concept of inflammation is significant, and it's a very complex web as we talk about, quote, inflammation, back to like, where is it coming from? What's hormonal, what's perimenopausal, what's a toxification, what's a liver piece. So the beautiful thing about as we combine integrated manual therapy, these skills to look at the organs, the tissues, the nervous system, with functional medicine, we can absolutely help our patients unpack and prioritize what are the most important things we need to address first. Because as I was talking to her, yes, we've got structural pieces. They've been there a long time. So my work in the clinic is addressing and unburdening the structure. But also, if not, perhaps first, is addressing that inflammation. And then as we uncover the story some more, there's gut issues, right? We still have some gut issues that she's kept under control, but there's still some pieces that haven't been fully supportive. So that is where, all right, we need to address cellular health, we need to address inflammation, we need to address some of those hidden food sensitivities. Again, I say all the time, I wish we didn't have to go there, but we have to. So many of us have these very subtle hidden food sensitivities, and we don't even realize that we're contributing to inflammation by some of these foods that are even healthy foods that we eat. So that was one of the first places I said we're going to need to explore. We need to identify what's lurking underneath the system or underneath the surface that's contributing to inflammation. And then from there, once we identify those pieces, we clean things up in her diet. Then those next steps are going into gut restoration. And the Institute for Functional Medicine has a fantastic going right to symptoms still, which yes, we're addressing symptoms, and they're going right into supplements. And it's important to address what's driving that inflammation in the first place, what's going on dietarily wise, and even stress wise on the nervous system. And then once we've identified those pieces and got those pieces in a better place, then we can dive into, okay, what do we need to bring in supplementally to heal the gut lining? What do we need to bring in supplementally to help rebalance that microbiome, because that is such a huge player in so many things. And as I pull things together, what I've seen in many of my patients are, here are these gut issues that have created, the inflammatory processes in the gut, which absolutely affect the intestinal mobility, the fascial mobility around the intestines, which contribute to lack of healthy, efficient mobility in the pelvis. So here is where it is so important for us to look at the patient as a whole person and look at all of the symptoms and systems, and then pull those pieces back together. So how do these affect the whole, and where do we need to start to unburden the system? And even if you don't, right? Many of us don't have functional medicine skills. Many of us don't have visceral vascular neural skills. Just starting to ask those questions, going through that medical systems questionnaire, like, where do we start? Or like, hey patient, here's how much I can help you. And actually that's what I told her. Like, I'm an amazing manual physical therapist, and I'm very, very good at what I do. However, if there is still underlying inflammation on a cellular level, I'm only going to be able to get you so far as your structural joint health as well, and your symptom and your pain. So I encourage you, continue to ask questions, continue to follow me. I'm trying to post as much as I can. I'm starting mentorship because we finished that conversation. She's like, I'm excited. I'm so excited to work with you because she's worked with many other practitioners. And she's like, this is the first time I've heard someone who say, I can help pull some of these pieces together. I can help you organize some of these pieces instead of here's parts and pieces, which have been helpful for her, which is fantastic. But there's still this integration piece that needs to be done and said. But at the same time, she's like, I'm sad because it's taken me forever to get into, and knowing how many people, number one, don't know about the work that we do. And then number two, it's really hard to get into us at this level because there are so many people. So we need more people to start to look at the human as a whole integrative unit. And I'm here to teach you. I'm here to support you. Follow me, come join me. There's lots of patients, lots of people